Hello, my name is Emma Langley. I am a public health student at the CUNY Graduate School of Public Health and Health Policy in New York City. This presentation covers the results of my fieldwork project on behalf of the Family Assistance Program at the Catholic Charities of the Archdiocese of Galveston, Houston during the summer of 2020. The planning for this project began with an interest in investigating the emergency food system in the Houston region and the role of private actors such as food banks and pantries in addressing food insecurity. Our objective was to support Catholic Charities in thinking about the root causes of hunger and what role the agency can play in addressing it. And we formalized this goal into a three-part series of questions. First, very fundamentally, what is food insecurity and who is most vulnerable to being food insecure in the Houston region? Second, what strategies do people employ to cope with food insecurity? And within these strategies, what role does the charitable food system play? And third and finally, how might these answers to these questions inform priority setting for Catholic Charities and the Family Assistance Program? So first, to give a bit of background, food insecurity as defined by the United States Department of Agriculture, or USDA, is a household level economic and social condition of limited or uncertain access to food. I think it's important to note that food insecurity is a global health issue. And in respect to how we're discussing it today, food insecurity in this urban environment is an issue primarily of access, affordability, and utilization of food. The other thing that I'd like to acknowledge is that many in our communities are facing a real moment of crisis related to food security right now. But food insecurity is not only an emergency issue. On the left-hand side here, we have data from USDA's Economic Research Service, which shows that in recent years, the food insecurity prevalence in Texas has been continuously higher than in other parts of the country. And taking an even longer view, we can get a broad sense of what's happening in the United States as a whole in the last couple of decades. Here on the right, we can see that there was a really sharp rise in food insecurity, and that went along with the 2007-2008 Great Recession. But I want to note that the recession officially ended in June of 2009. But as we can see, food insecurity remained persistently high for more than 5 years following, and had only just descended to reach pre-recession levels in 2018. And obviously that change and improvement has been turned on its head now because of the economic and social impacts of the COVID-19 crisis. So even knowing that food insecurity is a persistent public health problem, it's still a fair question to ask, what is the relevance of looking back before this moment of crisis? This image here was taken on July 12th in the parking lot of the Houston Food Bank. And as your staff and volunteers at Catholic Charities know well, the rise in demand for charitable food following the COVID-19 crisis has been truly unprecedented. And in many ways, the face of who is food insecure is changing rapidly in this environment. However, I would put forward that we are in a watershed moment for our food systems. The impact of the coronavirus disease has put a spotlight on longstanding disparities among low-income households, immigrants, communities of color. And we have an opportunity to raise the issue of hunger in America to the public consciousness and catalyze real systemic change in our urban food systems. This is also an inflection point where we have an opportunity to talk about the role of the charitable food system and particularly the expectations placed on programs like Catholic Charities and its Family Assistance Program to meet this kind of demand despite chronic underinvestment in public health in Texas and across the country. And finally, if we recall what we learned looking at the impact of the Great Recession, we can expect that many Houston families will be feeling the impact of this latest crisis long after the pandemic is over, and some will be quick to say that our nation has recovered. So in this respect, I think it can be really helpful to look at where we were immediately preceding this crisis, to understand and validate the work Catholic Charities has been doing in the community for more than 40 years, and to get a sense of who in this moment and moving forward is likely to be in continued need for months and potentially years to come. So who is food insecure in the United States? To help answer this question, I'd first like to take a moment to clarify the methodology that is used in the literature to study food security in the United States. The gold standard survey methodology has been developed by the USDA, and it includes an 18-question core module which captures characteristic conditions and experiences of food insufficiency and the behavioral responses of household members to these conditions. Local area surveys like the Kinder Institute's Kinder Houston Area Survey and the Urban Institute's Wellbeing and Basic Needs Survey tend to use a subset of the core module to develop local area prevalence estimates comparable to state and national benchmarks. And this is the case for Feeding America's monitoring as well in their Map the Meal Gap study. Now, this data here on food insecurity in the United States is unlikely to be groundbreaking news to your teams as experts in service provision. There are a number of demographic characteristics associated with increased risk of food insecurity. We know that children and households with children, particularly if they're headed by a single parent, and also particularly if that parent is a person of color, are much more likely to experience food insecurity. We also know that there's a strong economic dimension to food insecurity, but there are a number of other mediating factors beyond income. We see here that all households below 185% of the federal poverty level are see an increased prevalence of food insecurity. And 185% may seem like a strange number, but this is a threshold that USDA uses in the food security supplement of the current population survey. This is the threshold at which households are no longer asked questions about food security. And this is part of the reason why USDA actually underestimates food insufficiency as well as charitable food use, which we'll talk about a little later. Looking at a more local level, using primarily information from Feeding America's Map the Meal Gap study. I think that this is a really telling and interesting map. We're looking at the 50 area codes which comprise the vast majority of where the Central Region Food Pantry's clients lived in 2019. Looking at the food insecurity prevalence by area code. So the food pantry at Catholic Charities is not zip code restricted. And of course, you have satellite programs which draw resources from the pantry. And so the end result is that you see that you're serving a very broad cross-section of the Houston area. The other thing that I think is really telling here is the heterogeneity or the differences of food insecurity across the city. And these differences map very closely with patterns of area income and racial and ethnic composition. And it speaks to significant intergroup inequalities in Houston. Taking a look here a little closer to home, these are the top 15 area codes which represent the majority of where your pantry clients lived in 2019. And so you can see that while you have a broad reach, you're primarily serving the local community and a number of Houston's most food insecure communities. Looking at this another way, here we have those top 15 area codes again, ranked by prevalence of food insecurity and demonstrating the dramatic overrepresentation of non-Hispanic, Black, and Hispanic households. And the reason that this is so important is that on the one hand, we can talk about how prior to the coronavirus COVID-19 pandemic, food insecurity prevalence across the city of Houston was an estimated 14.8%, which is higher than the state of Texas generally and the national average. But even that elevated rate masks very dramatic differences across the city. The pantry's home zip code, 77003, has a food insecurity prevalence of over 25%, based on the most recent available data. And this is, again, from Feeding America's Map the Meal Gap, but there are other local sources of information which reinforce these findings. So aggregating responses from 2017 to 2020, the Kinder Institute survey results for Houston revealed quite strikingly that 54% of US-born Hispanics, 39% of Hispanic immigrants, and 36% of African-American respondents to the survey reported that they sometimes struggled to pay for groceries, and that's compared with 23% of US-born white respondents. And again, the University of Texas UT Health Public Health School conducts a Health of Houston survey. The results from 2017 to 2018 showed high rates of food hardship among its sample of nearly 5,700 Harris County residents. They found that 19% of participants reported experiencing food insecurity sometimes within the last 12 months. And Hispanic and non-Hispanic Black adults surveyed were more than twice as likely as non-Hispanic whites to report sometimes or often experiencing food insecurity. So having a better perspective of in our area who is most often experiencing food insecurity, how do people cope with food insecurity? And I think that it's helpful to organize our understanding of this on a number of different levels, the first of which being household and individual level coping strategies. The reason that we say that is because we know that people do not pursue public assistance or charitable assistance as a first line response to food hardship. More often they resort to other measures and exhaust their own resources. So one, for instance, purchasing less expensive, which often means less nutritious food. In severe cases, skipping or cutting meals to help make food last longer. Making trade-offs with other essential expenses like filling prescriptions, paying medical bills, seeking medical care, paying for utility bills or housing expenses. And very often we see households prioritizing access to food for certain household members, most often children. One of the ways that we can see evidence of this pattern is by looking at enrollment in the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. We see that those who enroll in SNAP face much higher rates of food insecurity compared to those who are eligible but not enrolled in similar income brackets. And this reflects that people tend not to sign up for SNAP benefits until they are really in need and experiencing food hardship that they're not able to manage on their own. And at that point, of course, a second level is public food and nutrition assistance programs. And SNAP is really the biggest and the most important among these. It has been proven to be an effective and efficient source of assistance for families in need. However, public benefits are frequently inaccessible or inadequate to address food security needs. An estimated 22% of Houstonians who qualify for SNAP do not enroll. The reasons for this really range. Some that have been identified are concern over how benefit receipt will impact immigration status, difficulty completing the lengthy application process, misinformation about eligibility, stigma, shame, and other barriers. And then we also know that there are a number of households who are food insecure that are not eligible for SNAP. USDA estimates that SNAP provides benefits to less than half of food insecure households nationwide, about 41%. And finally, many people who are eligible for SNAP and who are enrolled in public benefits continue to struggle with food insecurity. This is a complex issue, but a key problem identified is that SNAP benefits are simply not sufficient. The Urban Institute did an interesting study in 2018 and found that the maximum SNAP benefit amount, which would be available to households with zero net income, is not enough to pay for a low-income meal in nearly every U.S. county. In Harris County, they found that the gap is about 18%. There are other ways that we find evidence that SNAP is insufficient, and some of those are in relation to the behavior we see of people in terms of when and how they spend SNAP benefits. One study showed that more than a third, about 39% of SNAP recipients will spend 2/3 of their monthly benefits within the first 4 days of receiving them. Another study showed that a typical SNAP recipient household will exhaust 80% of benefits by the second week of the month. And this cycle can lead recipient households to go through periods of deprivation at the end of the month that we know are particularly harmful to health, especially for those with chronic diet-related diseases like diabetes. And so in these gaps that we're talking about in relation to public benefits, this is one of the places where the charitable food system really comes into play. Food banks and pantries in the United States have been tasked with an increasingly significant role in bridging the food security gap left by public assistance. And estimates of how many people are accessing charitable food is actually somewhat challenging and an understudied area. Feeding America's Hunger in America study is the largest and most comprehensive investigation of charitable food receipt in the United States. And their most recent results estimated that 46 million people received charitable food each year. Since 2017, the Urban Institute has also collected data on charitable food use from a large sample of non-elderly U.S. adults. In the study, 1 in 10 respondents reported that they or someone in their household used charitable food services in 30 days prior to the survey. And these results together suggest a much greater use of charitable food services than has been reported by USDA. However, USDA freely admits that these discrepancies can be explained in part due to limitations in their methodology, which likely undercounts utilization of such resources. But their official figure is that 18.8 million people used food pantries and 1.6 used kitchen programs in the last year. So who then is accessing charitable food? Are they similar to the population who is food insecure? Are they similar to the population who is receiving public benefits? Do they overlap? Are they different? These are important questions for us. And what we find is, perhaps unsurprisingly, that the characteristics of populations who are accessing charitable food do appear to parallel groups identified as having greater risk for food insecurity. Women, single parents, non-Hispanic, Black, and Hispanic households, recipients of are more likely to be recipients of charitable food use, as are households with family income below 200% of the federal poverty level. So by all measures, recipients of charitable food are largely food insecure. And not only that, but they typically experience other forms of material hardship, such as difficulty paying housing and utility expenses or medical bills. In a really interesting study, Columbia University looked at SNAP and food pantry users in New York City. And they found that while demographics were pretty much the same between the two groups, it didn't vary significantly. The pantry population appeared to be much more disadvantaged. And this is, of course, specific to New York City, but it is consistent with other findings. The Hunger in America study similarly found that 72% of client households were living in poverty. And looking at Catholic Charity's own service area in Houston, we know that in 2019, 95% of pantry clients with reported income reported being at or below the federal poverty level. Interestingly, the literature suggests that the majority of pantry recipients are also accessing public assistance like SNAP or WIC and free and reduced price school meals, and also that more than half are employed. This really speaks to the fact that food insecurity is a symptom of a broader issue of urban poverty, which is driven by issues of income, affordable housing, and other social determinants of health. And we also can see that there's a significant amount of client self-selection happening, such that much like with SNAP, those seeking out your services and that of food banks and pantries are truly those in greatest need. And also, as with public assistance, there are significant barriers to access, which are concrete and cultural in nature. Limited and unreliable hours, long wait times, lack of transportation, lack of information about services. All these things create significant operational barriers for access to charitable food assistance, as do structural resource challenges such as insufficient, or untrained pantry staff. We know that age and disability, illness, childcare issues may also create access barriers. And again, the issues of shame and stigma and negative culturally mediated perceptions of food pantries create barriers to access. So based on these challenges, greater investment in pantry programs to increase utilization and quality of services can really have a significant impact. So first, we definitely recommend, where possible, to implement measures that reduce stigma and increase agency for pantry clients. There is a growing body of research, for instance, that finds that the client choice distribution model and other measures to reduce stigma and empower recipients has a positive impact on their food security and diet quality. So the client choice model refers to reorienting food distribution of pantries so that clients choose their own food rather than receiving something that is prepackaged, predetermined for them, so that they can select items that they want and need at that time, that they know how to prepare, that is appropriate for them and for their families. And as I mentioned, the research in this area is very promising. A systematic review of pantry-based interventions concluded that the choice model can enhance clients' food security status, fresh produce intake, nutritional knowledge, and diet-related outcomes. So in addition to this, we recommend investing in pantry capacity through skilled staffing, increased capacity to handle fresh and nutritious food through cold storage, extended and reliable operating hours, and strong community partnerships that make your services accessible and dignified and robust for your clients. And of course, we also recommend continuing to promote and provide access to enrollment in public benefits, be they SNAP or WIC or otherwise. As we know, and as we've seen, charitable food is an increasingly and incredibly important part of our social safety net, but it's not one that can meet the need on its own. And we see that now more than ever. So in addition to promoting access to these things, Catholic Charities can also play an important role by advocating for making these benefits more robust and accessible to those who need them. I hope that you have enjoyed this presentation, hopefully learned something from it, and I hope to have the opportunity to collaborate with Catholic Charities and the amazing work that it's doing in the Houston area to fill a gap and meet a huge need in the community. So thank you again.